There you have it. There you have it. We just cracked the case. We injected half of her face, the right side with Jeuveau, and we injected the left side of her face with Botox. So why don't you go ahead and raise your brows as far up as you can, really aggressively. Okay. Probably a little bit more movement on the right side. I think the Botox side is still doing pretty well. So maybe the Jeuveau side is wearing off a little bit sooner. Angry face, frowny face. So that seems pretty symmetric. And then a big, huge smile. And that's pretty much exactly the same, and the crow's feet are still actually pretty good. In terms of the forehead, maybe a little bit more movement. Now, one of the things physicians and injectors have been postulating is that there's less diffusion with Jeuveau. For the forehead, you want a little bit more diffusion because it's such a large surface area. For very delicate areas like the eyes, you don't want it to diffuse and potentially affect the levator and give you some sort of ptosis. It may not necessarily be that it's worn off faster. It may be that it's just acting a little bit more localized and you're starting to get a little bit of movement in areas that it didn't, diffuse to.
I definitely notice the difference between the two sides, just in the way they feel.
Okay.
It just feels more like firm and stiff.
More firm and stiff?
Yeah.
Okay.
It adds more movement.
Which did you prefer initially and what do you prefer now?
Like very little movement.
Very little movement. But there are lots and lots of patients that say, I don't want to be frozen, I want a little bit of movement.
But I want no wrinkles.
But I want no wrinkles. For patients that want a little bit of a softer effect, I think Jeuveau might be more appropriate. Patients that want a little bit more of a firm, hold on their wrinkles, I guess we can. There you have it. There you have it. We just cracked the case. We cracked the case.